Good afternoon, and welcome to another episode of CTLN Opinion Plus. As you know, this is a space for Latinos and our issues and our concerns. This week, we are talking about the necessary and very important topic that is healthcare, and we are joined by Ted Doolittle, the healthcare advocate for the state of Connecticut. Welcome, Ted. How are you?
I'm doing great. How are you, Swanee?
Good, good, good. Getting used to working inside since it's been close to a year. So why don't you give us a brief about your role as the healthcare advocate?
Okay. So the healthcare advocate in the state of Connecticut is a unique role. We're the only state that has an office exactly like this. We're dedicated to helping the residents of Connecticut who are having difficulties or want help in dealing with any type of managed care or health insurance. So we have a staff of nurses, attorneys, paralegals, and others who are dedicated to taking in and resolving complaints from residents of Connecticut around healthcare, be it a claim denial, your doctor has prescribed something and the insurance company has denied it, or some type of enrollment problem with the insurance company. Anything that's health insurance related, we can help the residents of Connecticut. We're a small but mighty team. We have a staff of 18, and of particular interest to your audience, we have had a focus in our recruitment on making sure we have Spanish language capabilities. We have 2 native speakers and 2 other fluent speakers out of our 18. So I think we're well positioned to try to assist the Latinx community in Connecticut.
That's really good. I think it's undervalued just how important it is to have someone to relate to and to speak to in your own language, and not just your own language, but your own experience, because each community has different health needs.
Sure.
Yeah, and many patients, they go into county hospitals. A lot of them don't have insurance, and the first thing that they ask is, "Can I speak to someone about how to pay for this?" How is it a case-by-case basis on how you help people with healthcare and in paying for their treatments?
Yes, it is. It's the many colors of the rainbow. That's the type of cases we get all over the map. Folks that don't have insurance, we can and often do try to connect them with either insurance or if they're qualified for Husky or for a free or reduced price plan on the Obamacare exchange, or if they just don't have insurance, from time to time we will help negotiate discounts with hospitals and other providers.
I imagine this is a busy time for you with everything going on in the country. How important is your role like at this time now that we are in a pandemic, hospitals are overrun? Are you finding yourself stretched, I guess?
Well, we were bracing for a huge amount of COVID-related things, people with questions about getting tests paid for or getting care paid for, and now, thank goodness, getting vaccines paid for. I will say that flood never really materialized, and I hope it is because the insurance companies and other payers are paying for these COVID-related services. So we haven't seen a COVID-related surge. We're always every day ready for it, but it just never kind of materialized. And of course, as you know, during especially the early parts of the lockdown, we're still, as you know, in restrictions now. But during the earliest part of the lockdown, when optional medical care was canceled, of course, that resulted in fewer disputes with the insurance company because that knee replacement wasn't happening, and so there wasn't a dispute over who would bill for it. So we did actually see a decline in cases for a few months. It is starting to tick back up a little bit now.
We have the vaccine that's coming out. Shipments are being distributed across every state in the country. Why is your role as the healthcare advocate so imperative during this time when the vaccine is becoming readily available?
Yeah, well, at OHA, the Office of the Healthcare Advocate, we often play a connecting role and a catalyzing role and a coordinating role. And in this situation, when the vaccines are coming out, people are not being asked to pay for it. So that is off the table. And that actually is a rare situation in America. We're really acting more like other advanced countries uh,
Hmm.
in that regard. But uh, we do have uh, uh, our eyes really on helping people get access to the vaccine. There's long phone lines, a lot of delays, and people getting through. Of interest to your audience in particular is the fact that the Federal Vaccine Administration Management System, called VAMS, that's an online system that you can go on to schedule your vaccine. It doesn't have Spanish language. That's a glaring deficiency. And Connecticut, among I'm sure other states, has raised this with the federal government. So we're hoping to get that resolved. The phone support that Connecticut offers, on the other hand, does have the Spanish language support. And you know, I don't know why it was rolled out that way. Perhaps just in the rush of trying to get things out quickly. But that is something that's being worked on.
So, so to be clear, the website is not available in Spanish, but the phone line is.
I believe that's correct. Yes.
Interesting.
Yeah. Yeah.
Uh,
And hopefully that will be corrected as soon as possible.
I hope so. You mentioned more advanced countries and their healthcare. We have a new administration. Healthcare is one of their big topics. How would your role change if we did some sort of form of universal healthcare? I know Obamacare, the Affordable Care Act, was the first iteration of that, but how do you see your role changing as we are leaning towards a universal healthcare type of thing?
Yeah. Well, people sometimes talk about Medicare for all, and I actually was a senior official in the Obama administration in Medicare for several years, so I know that program quite well. And one thing people don't understand about Medicare for all, and I support any type of healthcare expansion, including a variety of the Medicare for all proposals that are out there. But one thing people don't understand about Medicare is that it's not itself um, a panacea. It's not going to solve everybody's problem
Right.
getting health care. In fact, Medicare patients sometimes get claims denied, for instance, and then there's an appeal process in Medicare, just the way there can be in a private insurance company. So my office's role, helping patients who are trying to get care that's been denied, covered, and then paid for, it is frankly not going to go away, I don't think, in any of the major proposals that have been discussed over the past few years. Even in Medicare, again, there's claim denials, and I wish that other states had offices like OHA to help people negotiate those appeal processes, and Medicare as well. By the way, I should mention that my office will assist anybody with any type of coverage, be it Medicaid Husky, be it Medicare, or be it any type of private insurance, or even one of these new healthcare sharing ministries. Any way that you get health coverage, we are by statute empowered to help you out.
That's so good to know. I know so many people are afraid of the process of getting healthcare. It's a long questionnaire. People are denied for things like a headache, and so it makes people hesitant to apply. So it's good to know that an office like this exists in Connecticut.
Yep, yep, yeah. I sometimes refer to us as the best kept secret in state government because people don't know about it. I can talk to a room, well, back in the pre-COVID days, I could talk to a room of 20 people, and I knew that the next day I'd get one or two calls because people just didn't know about the service, but they or a relative or a loved one or neighbor had that need, and it's going on all over the state. So Connecticut really is lucky to have this program. It was stood up first in 1999 and really is cutting edge. Not many states have anything like it.
I want to touch on that. Touch on not many other states having your office next, but I do have one question. Communities like mine are weary of healthcare, are weary of dealing with healthcare. How is your office reaching out to communities that are hard to reach?
Yeah, well, we of course, our outreach has changed dramatically due to the pandemic. You know, we used to be able to get out in the community and attend health fairs do presentations at senior centers. Now that work has gone virtual, and we're trying to figure out ways to do that effectively. We also try to reach out to all types of providers, whether it's cold calling them and making sure they know about us, because of course the providers are trying to get the bill paid just as we are. So your doctor or your hospital can work hand in glove with us. But it is a challenge to get the word out, and I do feel like if somebody dropped $1 million into OHA and we were able to have a TV ad campaign that was significant, a lot more people would rush to our services. As it is, it's really word of mouth. Although I should say that if you do get a denial, if you look through the boilerplate, you will find actually our contact information back in there. It's too small and it's a little hard to find, but it will be in there if you have a denial.
Okay, I will be sure to mention it often to anybody that I know. So you mentioned that your office is unique. Not many states have a healthcare advocate. Why do you think that is when there's so many sick people in this country? Your office would be beneficial. Why do you think there is not?
Yeah, well, there was actually an effort. Interestingly, part of the ACA gave funding to other states, but it lapsed. It was only a year or two, and I think most states, I am told, I wasn't here in the role at the time, but I'm told most states just kind of took the money and gave it to an existing state agency, as opposed to standing up a separate state agency like we did here. My office is actually an independent appointee of the governor. The governor does appoint me, but then I'm in for a specific amount of years. So I was appointed by the previous governor, and I'm serving under this governor. I don't really report to the governor, so I have this independence. If you don't have that type of independence, then I think it may be that type of independence and that type of statutory base. You know, we're in the statute, so we're not going to go away. If you don't have that, it's tough to get these started. I would like in future health reform laws that may pass in Congress, I would like for them to include funding for offices like OHA across the 50 states.
Well, I think that's all the time that we have for today. Thank you very much for joining us. It was really informative and really important that we discuss things like health insurance. So thank you very much.
Just happy to be here and happy to reach out to your audience, and I appreciate the platform. Thank you.
All right, thanks. That's all the time we have for today. Thank you to Ted for joining us. Tune in next week for another episode, and don't forget to follow us on all of our social media handles. Follow us on Twitter at CT Latino News and Instagram at CT_Latino News. I'm Savani Campos with CTLN Opinion Plus. See you next time.